Hey, good morning, Dr. Dave here. Nice to be with you as always. Continuing series on depression, major depressive disorder, major depressive episodes, clinical depression, syndromal depression. All right, as I have mentioned in recent videos, it's bad news, right? It's the most common psychiatric disorder in the world. It's the leading cause of disability in the world. It kills you 12 to 15 years before your time, before that, robbing you of everything you hold sacred, your humanity itself, if not careful. And yet we are no better at treating it than we were 70 years ago. Now, why is that? Well, that's because depression ain't no thing. T-H-A-N-G, all right, no thing. It's 227 different things. That's right. It is what we would call a very heterogeneous diagnosis, not disorder. For example, you can meet syndromal criteria for major depression and not be able to sleep or sleep all the time, not be able to sit still or not be able to move, not being able to eating all of the time. You see quickly how those are not the same biological entities. If you check 5 of 9 boxes that the DSM-5, the Diagnostic and Statistical Manual, 5th edition, that's our psychiatric Bible, be careful about what Bible you choose to worship, all right? That's another talk. This is the psychiatric Bible, very limited, useful, but limited. Okay. Check 5 of 9 boxes in terms of diagnostic criteria. You can come up with, that's right, 227 different endophenotypes, i.e. 227 different types of depression. Now, I break them down into 3 overlapping but somewhat distinct symptom-based subtypes. Okay, the first one is over here to your right or left, I don't know. Can't sleep, can't eat, can't sit still, weeping and a wailing, doom, despair, and agony on me. Take me, Lord, to be better off dead. High levels of anxiety, panic, OCD, right? These are the ones that might respond, at least temporarily, to the SSRIs, right? The selective serotonin reuptake inhibitors, perhaps the SNRIs, the selective norepinephrine, serotonin norepinephrine reuptake inhibitors might, for a time. It's about a third, maybe to a sixth of our patients with depression. That's it. Over here on the other side is the biological opposite. It's the old atypical depression. We now call it immunometabolic depression. And that would be you're sleeping all of the time. You're eating all of the time, particularly carbohydrate cravings. Brain fog, lethargy, fatigue, leaden paralysis. You feel like you weigh 1,000 pounds. It's all you can do to get one leg in front of the other. And then a profound lack of joy. You often have comorbid, coexisting PTSD, fibromyalgia, chronic fatigue. Sound like the same biological entities? Well, they are not. Indeed, they are not. All right, this is a little bit of a longer one. But when you come to me, and you are depressed, I've got to figure out what symptom-based subtype you have, because that really then influences heavily, nay, determines what treatment recommendations I'm going to make to you. Now, all right, so we got this melancholic, can't sleep, can't eat, can't sit still, weeping and wailing, doom, better off dead. And then we've got this flat line, Debbie Downer, Eeyore slug leaving a trail, right, where you're sleeping all the time, you're eating all the time, fatigue, leaden paralysis, no joy in Mudville. All right, well, you said 3 subtypes, Dave. Indeed, I did. Both of you that are still listening picked up on that. Okay. Well, there's a third type, and that's the mixed, wired, and tired, and that's what I usually see the most of. You have features of both of these subtypes of depression, where your brain won't stop, but your body won't go. You're all at up with fears about tomorrow, apprehensions. You worry too much, and yet you got fatigue, brain fog, lethargy, no joy in Mudville. That's that mixed, wired, and tired. Those are the people that usually self-medicate with speed in the morning and weed at night. That's right, speed and weed, puppy uppers, doggy downers, black coffee, red wine. Wait a second, 'tis I. Nevertheless, you get the picture. I got to know what type of depression you have before I can make responsible treatment recommendations. More on what those might look like next video. I'm already way over today. Anyhow, thanks for listening. Till I'm back, peace out.